So originally I wanted to do a video on these three talking about the mental health crisis. That includes Nick Ferrari and Nadine Dorris, and Hero of the Week, Ashley James. But the more I dived into this and the more the week went by, the more crap I heard from commentators who didn't know really what they were talking about. Have a listen to this.
Do you know what country has the worst mental health in the world? Monaco, the richest country in the world.
The average wage being 10 million a year, meaning that they can actually afford to hire therapists, psychiatrists, psychologists.
And if you go down the list, you will see that the countries with the worst mental health, i.e. the most referrals, the most therapists, the most psychiatrists, people who see psychiatrists, per capita, Monaco, Netherlands, Norway, Belgium, we're in the list as well, but a bit further down. So it's affluence. So there is a link between affluence and the kind of introspection which comes about.
And for Rod, that level of intelligence is on the same par as Donald Trump. Test too much and you'll find problems.
You know, testing is a double-edged sword. We've tested now 25 million people. It's probably 20 million people more than anybody else. Germany's done a lot. South Korea's done a lot. They call me, they say, the job you're doing, here's the bad part. When you do testing to that extent, you're gonna find more people, you're gonna find more cases. So I said to my people, slow the testing down, please. They test and they test. We got tests if people don't know what's going on. We got tests. We got another one over here. The young man's 10 years old. He's got the sniffles. He'll recover in about 15 minutes. That's a case. Add up to it. That's a case.
We will go back to Rod later, but let's have a listen to the three.
Has mental health culture gone too far?
Now, this has been created because a Tory MP went onto the Telegraph. You can see the writing in front of you, what was said. And basically, he tried to blame society itself for just being a little bit too soft. Almost like something Tony Soprano would say.
Didn't you admit to Dr. Cusimano that you were feeling depressed? Anxiety attacks are legitimate psychiatric emergencies.
Let me tell you something. Nowadays, everybody's got to go to shrinks and counselors and go on Sally Jesse Raphael and talk about their problems. Whatever happened to Gary Cooper, the strong, silent type? That was an American. He wasn't in touch with his feelings. He just did what he had to do. See, what they didn't know was once they got Gary Cooper in touch with his feelings, that they wouldn't be able to shut him up. And then it's dysfunction this, and dysfunction that, and dysfunction malfungo.
And this is where the affluence of Monaco comes in. They actually have time to be able to sit down and dissect what's happened to them in their childhood, as well as people in affluent nations being able to afford the internet, social media, and smartphones. But we'll come on to that later. And conservatives and the right seem to want to avoid talking about that at all costs. And I'm going to dissect that a little bit further because they've caused a lot of these problems.
And the relevant government Secretary of State or Minister, Mel Stride, has given an interview to a newspaper, the Daily Telegraph, and he says that he thinks the culture of mental health and protection has gone too far with the normal anxieties of life, his words not mine, being labelled as illnesses.
So as we go along in this interview, I'm going to break this down into 4 parts. COVID, perimenopause, poverty, and social media. And I'm not just going to use myself because I'm going to get an expert on, which is Dr. Armand, to talk about the things that these guys did and tried to justify in this morning's interview.
Dr. Daniel Amen,
the world's leading expert
on the brain.
Dr. Amen's mission is to end mental illness
by creating a revolution in brain health.
Why is this important? Well, there were about 2.4 million people who were signed off as unable to work. The number grew by 700,000 since the pandemic. All Mr. Stride is seeking to do is to try and get 150,000 of whom who have mild illnesses to try and encourage them to get back to work.
This almost sounds reasonable until you start picking it apart, and a large chunk of this, it's down to Brexit. Brexit has caused a labour shortage in the UK. That's why the government need as many people to the front as possible. So they're putting extra pressure on those with mental health issues. But on top of that, part of the reason the government can't afford to pay for this mental health crisis is simply because of Brexit damaging the economy, along with other things such as COVID. We'll come back to that later.
He's not dragging people who have physical disabilities or mental. He's trying to find those, and I think he's absolutely right, I'm very lucky. Nearly all my life I've been in work. Most of my life I've done work I've liked. Not always, but I won't name those companies. And I found it positively beneficial. I appreciate there will be people watching who have real concerns, but at the heart of what he's achieving, it makes total sense.
Except that's not what he said.
While I'm grateful for today's much more open approach to mental health, there is a danger that this has gone too far. There is a real risk now that we are labeling the normal ups and downs of human life as medical conditions, which then actually serve to hold people back and, ultimately, drive up the benefit bill.
Considering Stride is not an expert in mental health, and also his only experience that I could find is that he used to help set up conferences and exhibitions. I'm not sure we should be listening to his advice, yet the media have.
So I was mental health minister for 2 years, so I was actually steeped in this for a very long time. And there's a campaign which has been going for a very long time, which is called Parity of Esteem.
What she's just about to do is so disturbing, it's up there with the values of Nurse Ratched. I went onto the Royal College of Nursing website to see what that definition was, and have a listen.
Parity of esteem describes the need to value mental health equally to physical health. People with complex mental health needs should have the same access to healthcare services and support as people with physical health needs.
And that is why we treat mental health illness exactly the same way as we treat physical illness. And there is, of course, always going to be a knock-on effect and a consequence to this, and that is that those numbers of people who were out of work, who were signed off work for minor mental illness, those numbers were going to increase, and so was always the bill to the government.
Imagine being part of a football club where there are leaky roofs, players have team talks in shipping containers, and players are regularly injured. And the manager's telling you it's great because the tickets are so cheap. And whatever we do, we shouldn't investigate further for any problems, because it might end up costing the club even more money. Fans wouldn't tolerate it. Essentially what Nurse Ratched, Nadine Dorries, is saying is that there was always going to be an uptick because we'd never really invested in mental health before. And that then leads back to the 4 parts, which we will bring up shortly. But it also brings up the question of, they're blaming you for them not investing in mental health.
But the fact is, a government cannot sustain a £100 billion welfare bill for mental illness. It just can't be sustained.
This government is doing what it does best, and it's punching down. It's blaming its own incompetence on the most vulnerable in society. The Mind charity, who do so much to destigmatise and support those suffering with mental health, said that people in the poorest fifth of the population are twice as likely to suffer with mental health problems.
It's interesting she says that because have a listen to Rod Liddle talking in Question Time about poverty and its effect on mental health.
I just want to go back to the comment made earlier, which I think is absolutely ridiculous, saying that poverty has nothing to do with mental health. I'm a medical student, we all are, and we see day in, day out people who have a really rubbish situation at the moment because they can't afford food for their kids to put on the table. They've not got a job because there isn't the jobs up here because the Tory government haven't invested money up here. It's ridiculous that you think poverty has nothing to do with mental health.
It isn't. If you look at the figures, it's nothing to do with it at all.
I see people day in, day out who struggle with their mental health.
It just doesn't correlate.
Poverty causes stress. It doesn't give you access to certain resources. You can be socially excluded. It definitely has an impact on childhood development. And of course, this is all being ignored by the right. Even though poverty in the UK has increased, it is increasing. And in part, it's because of Brexit, in part because of COVID, in part because of austerity, and finally, because of these neoliberal ideas that the Tories are implementing that just make the rich richer and everyone else poorer.
What role does stress play on our brains?
Stress, especially chronic, unremitting stress. So if we think of the stress you had growing up, where there was a lot of fighting, it raises a hormone called cortisol. Cortisol begins to shrink activity in the hippocampus, one of the major memory and learning centers in the brain. So one could at least argue or postulate your struggle in school was because your emotional brain was busy because you were worried about things at home. It makes it more likely you get infections. It makes it more likely that you have learning problems.
results in you being more likely to have health problems, more likely to have problems regulating your behaviors. It's all about how our body responds to stress. The uncertainty, the anxieties, the day-to-day threat of not knowing whether you're going to have a roof over your head, will you put food on the table, all of those things are stressful. So people who've experienced lots of stress, whether it's from poverty, chronic abuse or neglect, chronic exposure to violence, often have problems focusing attention, problems setting goals, and developing plans to work toward them. These are exactly the skills you need to get out of poverty.
But did we hear anything about poverty from Nick or Nadine? No, of course not. Nothing about that. Nothing about making people's lives harder. And we'll come on to COVID in more detail shortly. I want to go back to what Ashley James had to say.
I think this government is doing what it does best, and it's punching down. It's blaming its own incompetence on the most vulnerable in society.
What you're about to hear are truth bombs, one after the other, and it's going to trigger Nadine.
The Mind charity, who do so much to destigmatise and support those suffering with mental health, said that people in the poorest fifth of the population are twice as likely to suffer with mental health problems, and people facing exceptionally difficult circumstances. Their research found that most people with mental health issues want to work. So wouldn't it be good to tailor support from experts to reduce NHS waiting times, I don't know, by maybe paying doctors and nurses so they can attract and retrain staff?
As the song goes, this girl is on fire.
I've got to come in on that.
Yeah,
I've got to come in that a second,
absolutely.
to that point.
We need access.
That face is absolutely priceless. Nadine is so angry. And yet, it's all justifiable. This is all of her work being brought up to her, and she doesn't like hearing it.
Can I just say, just before you jump in...
Who wants a tea?
There are currently 1.9 million people on the waiting list for NHS mental health, so we really do need to help people get back to work. We don't help people get back to work by saying, toughen up, get back to work, you're being work shy, and they keep going on about these economically inactive people. And actually, we know a lot of those people who want to work are leaving because of the astronomical childcare costs. And personally, I think if we want to look at wasting money and scroungers, the government should look a lot closer to home. Like even today, it's come out, Minister for Common Sense, Esther McVey, and her Tory MP husband using taxpayer money to fund rent on a second home, even though they have a London property. You know, there are so many examples of wasted money.
There's so many can I just bring it back to, not to politics, but to mental health?
Very snidey remark there that didn't make a lot of sense of let's focus on mental health and not politics, even though the reason this is being brought up is because a politician's written about it in a newspaper. And of course, Nadine Dorries doesn't like it when her fellow MPs are attacked because they're all horrible, nasty scroungers. Here are some examples.
And can I just bring it back to £3.2 billion when I was Mental Health Minister was given to mental health by Boris Johnson. It was the same budget. It was actually a bigger budget than the entire prisons estate in the UK. So we spend more on mental health than we do on all of our prisoners and all of our prisons.
That has to be up there as one of the stupidest comments ever by any politician. That number she just gave out, saying of equivalency between a prison system and mental health. There are 90 to 100,000 people in the prison system. There are 1.9 million people who need help and support in mental health. We know that the prison service is facing significant challenges due to underfunding at the moment. It's got aging infrastructure, overcrowding, inadequate living conditions, limited access to healthcare, and insufficient rehabilitation programs. And this is what she's using to compare with 1.9 million people who pay taxes, haven't broken the law, and are requesting help.
And one of the problems is when you say pay more doctors and nurses, it's a very specialised field that actually people aren't clamouring to work in.
And there currently are not enough spots available. We need more medical staff, but the government are only offering in 2024 an additional 205 places for medical staff. And we have a shortage. The words that are coming out of Nadine Dorries' mouth are vile and, frankly, some form of gaslighting to the public.
Gaslighting is a manipulative tactic that undermines a person's sense of reality and sanity, often portrayed in horror films like The Shining and Get Out, where the protagonists use gaslighting techniques to deceive people and conceal their sinister intentions, leading them to question their sanity and reality.
During COVID, little to no preparation had been made for an actual pandemic. There were few supplies, there was no track and trace system, and there was no infrastructure in place to stop people travelling into the country. Have a listen to Piers Morgan rip into the Transport Secretary Grant Shapps, quoting from a transport expert who has analysed what the government has done during COVID.
Grant Shapps has literally done the opposite of the world as Transport Secretary. He has done nothing. I would ask him what on earth he's been doing for the last 9 months. No airport testing, screening or measures since the pandemic began. None. No temperature checks, no health assessments, no flight restrictions throughout this entire pandemic. No measures to have air travel actually acknowledge we're in a pandemic. The lack of measures have contributed to the worst death toll in Europe, and he detailed what every other country has been doing. So I put it to you, what have you done?
And because of no plan by the government that is there to make sure there are plans, they ended up allowing herd immunity to spread the disease through the population.
And one of the theories is that, perhaps you could sort of take it on the chin, take it all in one go and allow the disease, as it were, to move through the population.
And because there's no track and trace, they had no other alternative but to lock us up in our houses.
This is where the US government got an F for the pandemic. Loneliness accelerates dementia and brain problems. And so when they isolated us, the whole significant increase in brain problems.
What about perimenopause?
Perimenopause, the transitional period leading to menopause, can have significant effects on mental health. Fluctuating hormone levels during perimenopause can lead to symptoms like mood swings, irritability, anxiety, and depression. Additionally, disrupted sleep can exacerbate stress. For some individuals, these symptoms can be severe and interfere with daily functioning, relationships, and overall quality of life.
Well, there have been shortages, and this is down to Brexit, despite what the government will tell you, which is generally along the lines of everyone around Europe's facing this. Italy, Spain, and Germany had no issues with HRT. That's hormone replacement therapy. Those are the drugs that you're meant to give people when they're going through perimenopause to alleviate the symptoms.
Dipti Tate has to use this hormone replacement gel every day. She can't produce her own estrogen because her ovaries have been removed. Without the gel, her mood is depressed, and alternative drugs just made her worse. It was only after the surgery she was told the drug she needs is in short supply.
Considering this can affect up to 60 to 80% of women going through perimenopause, you'd think the government would do something about it, but of course no, they haven't, and in part, that is also down to Brexit. Not only do we not have the money, but we also have a brain drain with over 600,000 people a year leaving the UK. So we need labs, and to fill those labs, we need scientists, doctors, and they're leaving for places like Australia.
We're certainly seeing record unemployment at the moment in Australia, but with that has come a bit of a skill shortage. We're particularly low on nurses, and I know the NHS is a great program in the UK, so we're looking for people to come in those public service positions.
And then there's social media.
And then there's social media. If you're on 3.5 hours a day, you begin to wear out those pleasure centers that bring you happiness, and they bring you pleasure, and they bring you drive. You thrill them to death.
Every time you get a like, a share, a comment, you get a small release of dopamine. And essentially it's because you're getting social proof. You're proving that to society you're worth something. The problem is it's addictive, and on top of that, it also sort of skews your brain, especially if you do over 3.5 hours a day. And the vast majority of the population are spending anywhere, especially teenagers, between 8 and 9 hours a day on social media, just scrolling through. And this reliance on digital platforms means that dopamine stimulation is altering the brain's reward system and making everyday activities seem less rewarding in comparison. Some of you might be surprised to hear Facebook, when they first started up, went to casinos to hire people in to figure out how to make their platform addictive, and it set a precedent. And finally, poverty.
I just want to go back to the comment made earlier, which I think is absolutely ridiculous, saying that poverty has nothing to do with mental health. I'm a medical student, we all are, and we see day in, day out people who have a really rubbish situation at the moment because they can't afford food for their kids to put on the table. They've not got a job because there isn't the jobs up here because the Tory government haven't invested money up here. It's ridiculous that you think poverty has nothing to do with mental health.
It isn't. It isn't. If you look at the figures, it's nothing to do with it at all.
I see people day in, day out who struggle with their mental health.
It just doesn't correlate.
Why on earth does Question Time allow people like this on who just make up stuff? How can I link something like mould to poverty? Well, it's definitely something that a lot of people in the UK have to deal with on a regular basis, and generally it's down to substandard housing, inadequate ventilation, heating, and insulation, and that all leads to dampness and mould growth. And of course, heating, with the prices going up and the cost of living crisis, it's something that people in poverty have to deal with on a regular basis. Have a listen to someone like Stephen Bartlett talk about it and his experiences, as well as Dr. Amon's analysis of what mould can do to the brain.
And a bit of a toxin, which may be mold.
Mm-hmm.
And
when
then,
I say mold, our house was very, very dirty growing up. So that's what I assume you're speaking to there. And we did have like mold around the windowsill sometimes, and we had mice and rats at some point.
Unfortunately for Stephen, in his childhood and many residing in the UK currently, mould is a constant issue. Have a listen to this.
but once it gets in your body, unless you do something active to get it out, it stays.
Oh, really?
And can continue to cause problems.
Figures from the social housing watchdog, shared exclusively with Sky News, paint a worrying picture. There were a record 3,500 complaints relating to mould, damp and leaks in social housing in the year to March 2022. But between April and November this year, there were more than 2,500 complaints, a rate that, if it continues, will surpass the record figure.
Rod doesn't make mention of this, neither does Nick, neither does Noreen. They're not talking about these problems that I've cited to you, but they're all over the place, and they are causing a mental health problem. And of course, problems such as damp or the heating or even food causes stress.
What role does stress play on our brains?
Stress, especially chronic unremitting stress. So if we think of the stress you had growing up, where there was a lot of fighting, it raises a hormone called cortisol. Cortisol begins to shrink activity in the hippocampus, one of the major memory and learning centers in the brain. So one could at least argue or postulate your struggle in school was because your emotional brain was busy because you were worried about things at home. It makes it more likely you get infections. It makes it more likely that you have learning problems.
And if in any way you think I'm exaggerating all of this, have a listen to what people are saying in A&E.
We're shown a hole in the wall. A young patient has hit her head repeatedly.
We're dealing with something that we've never seen before in terms of the volumes of these people coming into ED asking for help. It's our job to try to offer them compassionate, safe, effective care when they're here. It's becoming increasingly hard to do this when the service is under so much strain.
There are many reasons for this, he says, but it's not helped by the cost of living crisis, housing problems, children and temporary accommodation. And then he says, look at who's coming through the door.
The single largest age group is women or children between the ages of 10 and 19. Next after that is women between 20 and 29. The other area where we've seen our very longest waits in emergency departments have not actually been for mental health beds, it's been looked after children who've been waiting for a social care placement, and we've seen some extremely long waits with some of these children displaying very challenging behaviour. We've got a young teenager who's just finished 28 days in the emergency department waiting for a placement.
The fact that this hospital was willing for us to come in here and film and talk to them about the problem just shows how concerned they are. But what has also become obvious from some of the freedom of information requests that we've made is that this is a nationwide problem. Emergency departments are filling up with mental health patients who need to be somewhere else.
Let me know your thoughts in the comments to all of this, whether or not I've exaggerated the problems of poverty, or if the media are quelling the problems of poverty. Once again, I'd like to say thank you to all of my Patreon and YouTube supporters. You really keep this channel going and growing. If you'd like to help out this channel for free, please consider clicking the like and subscribe button. Thanks for listening. Bye for now.